Hello, welcome. This is the Standing Committee on Health and Social Development. Today is Wednesday, February 5th, 2021. And can I get an adoption of the agenda? One of the committee members? Heath McDonald. So today we have committee members welcoming Zach Bell, Heath McDonald, Trish Altez, Brad Trivers, Hannah Bell from the committee, and we have guests, MLAs Lynn Lund, Peter Bevan, Ola Hammerland, and Michelle Beaton. So what we'll do is we have a kind of a strict 1 hour time frame. We're going to try to keep to within that. So the first group of questions when we do get there will be to committee members, and then if we have some time afterwards, we'll open it up for sure when we get to that point. So I'm going to pass it over to our guest today. So we're welcoming Dr. Dave Hodgins, professor the Department of Psychology at the University of Calgary. Hello, David. Can you hear me?
Yes, I can. And thank you very much for the invitation.
Great. So what I'll do is I'll pass it over to you, and we're all interested in this important topic. So I'll pass it over to you for your presentations. Then we'll try to ask questions at the end, if that's okay.
Okay, that sounds good. So so I was asked just to give some background on online gambling and its potential harms and potential benefits. And so I put together sort of half a dozen or so PowerPoint slides, which I'm going to just share my screen, and I'll kind of just give you some facts and then some opinions, and then we'll open up to questions after that, if that makes sense.
Absolutely.
So I'm just sharing my screen now. Okay, so I think you can see my PowerPoint slides. Can someone just confirm that?
Yeah. Great.
Okay, great, thanks. So so I'm a psychologist working in the area of addiction, and one of the areas I've worked in over the last a number of years is gambling, and looking at gambling addiction, gambling harms, and how to prevent harms. And this, of course, has been something that has been of interest across Canada since gambling expanded back in the early 80s. And periodically there have been provincial surveys of the population to determine the numbers of people who are having gambling problems. And occasionally, but very rarely, we've had national surveys. So you guys are lucky because we've just released the results of a national survey. So the Canadian Community Health Survey, which is done by Stats Canada, that looks at a whole broad range of different types of issues and behaviors, included a new gambling module in its 2018 survey. And this hadn't been done since 2002. So it's nice that we have some fresh kind of data to be able to understand what's happening in each region, but also we can compare regions. And the overall, so how this is measured, it's measured in terms of asking people specifically how much they are gambling on different types of gambling activities. And there's a whole long list of possibilities. And then they're also asked to complete a 9-item problem gambling severity index. And so that's kind of used as the indicator of level of problems associated with gambling. And this is, it's actually a Canadian index, but it's pretty widely used around the world, everywhere really except the United States. So there's lots of ways to compare not only interprovincially here, but also with other jurisdictions if that's of interest. So the big kind of take-home message from this survey is that generally there's reduced gambling and reduced problem gambling overall over time in Canada. And we know this from other sources of information as well. So it's not an issue that's growing. And in fact, there's evidence that it's actually becoming less of an issue. And we understand that really because it's sort of a mature industry now. Population tends to adapt to issues like this, and that seems to have happened in Canada. So that the statistics then, and I won't spend a lot of time with these figures, but just to give you the background, is if you look, this is overall Canada, and about 2/3 of Canadians gamble in any given year, so in the past year. And the definition of gambling is pretty broad, so that it would include, buying a raffle ticket for the hockey team kind of thing, buying a lottery ticket occasionally, and so forth. So about 2/3 of Canadians do that. Maybe a little bit more in PEI, but not a dramatic difference. And again, here, this illustrates that in 2002, there were fewer people who describe themselves as non-gamblers than there is currently. So this is that scale, that index of problems. 63% would be in the no problem area, 2.7% are in a low risk area, and then 0.06% are in the problem area. And we've always kind of just described it as 1% of the population have gambling problems. Well, it's actually closer to 0.5% of the population these days. So the figures in PEI, there isn't sufficient numbers in PEI of problem people to actually do an estimate. So these are all the Atlantic provinces in general. So you can see that it actually hasn't dropped as much in the Atlantic provinces as it has in other areas of Canada, but it was relatively lower in 2002 in PEI. So what do we mean by problem gambling? So there is actually a formal medical diagnosis. Currently it's labeled gambling disorder. Previously it was referred to as pathological gambling. So if you do any reading in this area, any of the older literature will refer to pathological gambling. The newer literature will refer to gambling disorder. And then it also is referred to as compulsive gambling. So Gamblers Anonymous has that term and continues to use that term as well. But essentially what's a gambling addiction or a gambling disorder? It's really characterized by a person losing control over their gambling. So they don't actually lose control, but they have impairment of control over their gambling. So they really plan to, stop at the casino for an hour after work, but they'll end up spending a lot longer. Where they really plan to, maybe spend $50 on a visit to a casino, but they end up losing that and then trying to win it back by continuing to gamble. So that sort of struggle against wanting to gamble less, but actually gambling more, is really the core aspect of an addiction. And it's the same as an alcohol addiction in that sense. And then the other aspect of it is that the person continues to gamble despite the fact that it's pretty clear to them and to other people that it's causing them some negative consequences. So financial debts are of course the big one, but family problems, social problems, emotional health problems are particularly prevalent. And so the stress of getting behind on your debts and having these struggles with your family and so forth, and rates of suicide and suicidal ideation are high in gambling disorder. So people often kind of think, well, gambling disorder just sounds a lot less serious than alcohol disorder or alcoholism. And it really has very similar kinds of negative consequences. And fewer people have gambling disorder, but the consequences are pretty large. So another kind of important point, though, is that even non-problem gambling causes harm. So all of the negative consequences of gambling aren't reserved for people who have a diagnosis of gambling disorder. And again, it's similar if you think about alcohol, where people, people with alcoholism or alcohol dependence, have huge amounts of problems. But people who are on the other side of that boundary, who are heavy drinkers, also have problems. And that's also true with gambling. Another important kind of background piece of information is that different types of gambling pose different risks. So buying lottery tickets doesn't really cause very many people any issues. Playing slot machines and VLT machines, so we call them electronic gambling machines, at the other end of the spectrum cause, some argue, the majority of players problems. And so the faster the game and the type of reinforcement that you get playing, the more likely it is that a person will develop this impairment of control and this gambling disorder. And so the big categories are electronic gambling machines, slot machines, VLTs, and casino table games. And the reality that is not always acknowledged is that gambling profits disproportionately come from people who have gambling disorder, people who have gambling problems. And the reality then is if we make efforts to reduce the number of people having gambling problems, there is actually a financial reality to that. And it does affect the financial bottom line. And that's important to acknowledge upfront. So online gambling then, in this recent survey, it's still relatively low prevalence activity, so 6.4%. The range is from 5 to 8.3% across Canada and different provinces. In PEI, it's 5%, so it's at the low end, which you would expect given that it's barely available. And it's like all types of gambling, or most types of gambling, it's primarily man, but not exclusively man. So online gambling, you need to appreciate is a way of accessing different types of gambling. Right? So we tend to think of it as a type of gambling, but it's really a format or a platform for accessing different types of gambling. So in PEI, you've had online gambling for a long time because I believe you can buy lottery tickets online. And what the proposal, as I understand it, is really to increase the access to different types of gambling through an online gambling format. And the types do vary across the country, so it isn't uniform that all provinces are offering all types of gambling. So what's the big concern here? Well, the big concern is that there is this strong correlation between online gambling and problem gambling. So if you, that 6% of the population that gamble online, they're actually 4 times more likely to have a diagnosis of gambling disorder than people who don't gamble online. And why, what are some of the concerns about it? Well, it's really accessibility. Theoretically, at least, it could be available 24/7. There's also less social regulation because you're often gambling on your own. So you don't have family and friends with you or looking over your shoulder or involved. You can also play when you're intoxicated, and you can also play with credit as well. So these, we don't really know exactly, which of these features are relatively more important, but together they really increase the potential risk. What's clear is that it's linked with problem gambling. We don't really understand that completely. So it could be that online gambling is another way to access gambling. So it's particularly attractive to people with problems. So if you're really heavily engaged with gambling, then this is yet another way that you can play the slot machines, or that you can do casino table games. And in fact, most of the people who gamble online are also going to land-based venues. So they're also going to the casino, and then in addition, they're gambling online. So that's certainly a possibility. Or another possibility is that online gambling actually facilitates the development of play, just because it is so accessible, and is, the safeguards are just not as strong or they're different from what is available in a land-based casino. So, it's likely that both of these things are true, but we've got more to discover about that. Okay, so I've got 2 more slides, and I'm just going to kind of go over what are considered best practices of minimizing the harms that might be associated with online gambling. And the first one is to limit the types of gambling that are less harmful, or limit the offerings to the types of gambling that are less harmful. So don't give slot machines, don't provide table casino games, limit it more to bingo and lottery tickets and so forth. So that's one possibility. Another possibility, or an additional best practice, is to provide players alerts about their play while they're playing based on their risky play patterns. So in many jurisdictions, they've developed algorithms that can red flag people, essentially, that seem to be increasing the size of their bets, playing more frequently, and messages can be sent to those people, asking them or telling them or suggesting to them that they think about their play pattern. Third on the list is operator constraints on spending and time. So deposit limits, loss limits, time limits, not offering them 24/7, etc. And then the next one related to that is a mandatory player pre-commitment of how much they're wanting to spend and how much time they're wanting to spend. And many online programs offer this as a choice to the player. What's real clear is that it's not a choice that the people who need to make that choice are making. And in some jurisdictions, they've moved towards making this mandatory. So basically, when you sign up and sign in, you need to think about what you're willing to lose. And the notion of this is that it separates the decision-making from the heat of the moment. And people aren't, because they're losing or because they're hot, or they're not kind of making decisions on the fly that they would regret previously. So very sensible. None of the jurisdictions in Canada to date are doing that, I don't believe. Next on the list is to provide incentives for responsible play versus excessive play. So basically the loyalty cards should show loyalty towards people using some of the responsible gambling features or gambling responsibly, as opposed to just gambling a lot and getting more points for the amount of gambling you're doing. Another best practice would be to provide continuous feedback to the player on how much they've lost and how much time they've spent. And then also related to that is to have pop-up messages after people have played a certain amount of time. So for example, 60 minutes, you get a pop-up reminding you that you've played that amount of time, asking whether you want to continue to play or not. Providing strong identity checks to limit underage play. not providing free play on the sites beyond what you need to provide for people to learn how to play a game. So what we know from some jurisdictions, at least, is that the odds are actually better in the free play section. So people kind of get a sense that they may be able to do better than they actually can, and will then migrate from the free sites to the paid sites. So really not providing this gateway would be a best practice. Providing links to helping resources as integrated into the online platform, and helping resources for people along the entire sort of spectrum of problems. So, counseling for people who might have a gambling disorder, but more sort of advice and support to people who are not quite at that level, but are feeling negative consequences. And then the last bullet is really to evaluate the impacts. So this is a moving situation, and there tend to be a lot of opinions about what's right or wrong, and what's harmful and not harmful. I think the more we can actually collect good data and use that data to inform our decision making, the better off we will all be. And I think we have an opportunity to contribute not only to the best practices in our own jurisdictions, but in other jurisdictions as well, if we do a good job of actually collecting the information about the impact of what our decisions are. So I am going to stop sharing and basically open it up to questions.
Thank you very much, David. Appreciate the presentation, and we do have a good bit of time for questions. So I'm just going to turn it over to the committee to see who wants to go first. Questions. Yeah. You're getting a question from Zach Bell.
Thank you, Chair. Thank you for the presentation, David. You mentioned the other jurisdictions in Canada. What other jurisdictions are presently using an online gaming feature?
I'm not necessarily up to date. Essentially, all the provinces have something now, except I think maybe Saskatchewan. But the provinces where there's a full array of services available are BC, Ontario, Quebec, and I believe Manitoba. Alberta is just gone into the space, and their offerings are being rolled out over a number of months. So I don't remember exactly where they're at.
Zach?
Thank you, Chair. And on top of that, you mentioned the different provinces. Do they have any of the recommendations that you kind of had just showed us in your slideshow? Are there any of those in place in any of the provinces?
So I am, sort of reluctant to kind of cite that because I haven't really done a thorough assessment of it. And some of them, it's hard to know. So that information isn't easily publicly available, at least to me. So some of these features show up in some ways in some of the sites, certainly, but there isn't, that I'm aware of, a sort of a good source that you can specifically understand what each province has determined or included as their best practices.
I think that's good for him.
Okay, perfect. I'm opening up to all members now. I don't know if anybody has any other questions. Yeah, Hannah Bell.
Thank you, Chair. Thank you very much for the presentation. You'd spoken about a number of the. Can you hear me? Okay.
Yeah, I can.
Yeah. Okay. You'd spoken about a number of the ways that you can kind of manage risk, some of the risk for people sort of being online at home. And I apologize if I missed this, but there are quite a few of those things are also things that are really, you can get around them if you really wanted to, you know, pop-up blockers, incognito mode, multiple accounts. And so I'm wondering about really thinking that some of those are a bit more performative than functional if people really want to do, you know, to spend a lot of time online doing this, and that you can actually, it's pretty straightforward to do so. Is that something that you've considered?
Yeah. So, yeah, so there's not, yeah, you were breaking up a little bit, so I'm hoping I'm not breaking up as well. But I got the gist of your question, which, you know, is that there's not, you know, none of the best practices are going to eliminate the possibility that people will get over involved with online gambling, and that's, you know, that's absolutely true. So they're really features to minimize the harm and to make it less likely that people will, but it's not going to stop anybody. You know, there has been, you know, concern in the field that a number of the responsible gambling features that have been available for gambling generally have been more kind of window dressing than they are actually, you know, effective strategies. And that, I think there's been a shift in that, some of a shift in that over time, but you know, that risk is still there. So that's why I really, you know, strongly encourage evaluation of the strategy. And a really good example of that are the pre-commitment tools, where it's pretty clear through evaluation that they look good. I mean, it makes sense that, you know, players would use these safeguards where they just, you know, click and indicate how much they're wanting to spend that day and, you know, how much they're willing to spend per month and per year on gambling. But the people who are, you know, needing to use those features aren't using them. And so really it makes more sense that they be mandatory and that people need to, they need to state it up front. So that's gonna protect some people. But of course, you know, there's still gonna be the possibility of, you know, people putting in very large limits and limits that are larger than they can actually afford. And, you know, that's the trade-off. Yeah, that's the trade-off. And it's the, you know, we are making those kind of decisions with other addictive behaviors. Like if you think about alcohol, I mean, you know, it's a dangerous drug, and, you know, lots of people drink too much. We have some policies and rules in place to try to contain that. But we've made the decision that we're kind of, you know, reasonably comfortable with a certain level of danger, I guess. And, you know, I think we're in that process with gambling where, you know, should it be a, you know, complete free-for-all, or, you know, where are the limits that we want to put in place? And in the gambling field, we had a long tradition of arguing that really we just need to educate the person who's gambling, and you know, that's our responsibility. So let's give them the information, let them make their own decision. And it's really clear that that's overly simplistic, and in the same sense that telling people that alcohol is potentially dangerous isn't going to be sufficient at limiting alcohol-related harm. That we have taxation laws to decrease sales, we have age laws, we have server laws, and we have all sorts of other policies that work together to minimize harm.
Annabelle?
Thank you, Chair. I appreciate the honesty of the response, because you know, what I got at the beginning when you were talking about you know, compulsive gambling or gambling disorder is that very small number that has a very big problem, and you know, when it's an addiction like that, we know that addiction leads people to find ways to feed their addiction. So, the barriers are speed bumps, not barriers. They may potentially prevent people who are kind of, playing with it rather than, that I can see the challenge there in actually addressing that small but impactful number.
Yeah.
We talked here, you had said earlier that the number, 0.6%. So that's still 950 people, right? So that's a significant number. Any number is impactful, but that's a lot of people.
It
The
is.
thing that we've also heard about a concern with online gambling is the capacity for just the scale of the gambling that's taking place compared to something like VLTs, for example, where the bets are much larger and people can use credit cards. So is there a way that we also don't only measure how many people, but the scale of the depth of their addiction?
So I'm not sure if I'm completely understanding the question. So you're wondering about, the 0.06%, sort of how serious their addiction is, or I'm not understanding.
No, I know there's a lot to unpack. So yeah, we have a number of those who are most seriously addicted.
Yeah.
We may not necessarily see an increase in that number if we add another form of gambling in. Would we see an increase in the depth of their addiction, the impact of their addiction?
Yeah. So that's right. So that's likely true at some level. So it's likely true just because it gives them more options of gambling. And as I mentioned, most of the people who are gambling online are gambling in land-based casinos as well. What we know is that in places that have offered online gambling locally, that it doesn't, recapture the market of people who are gambling outside the jurisdiction completely, and so it sort of provides a new market, new players. It increases the market, and it also provides those individuals with another source of gambling. Now, it may be a safer source of gambling relative to some of the illegal sites, but it's another source of gambling. So for sure, there's that risk that for the 950 people who currently have gambling problems in PEI, that's for some of them at least, their problem will become more entrenched and more serious. If you want to take an optimistic kind of perspective on it, I guess, some of the links to treatment services and support for those individuals may be more readily available because if they're gambling online and they actually get alerts about their gambling and they're kind of nudged towards beginning to address it, maybe that will be effective. But those things have to be in place if that's going to be a possibility. Another comment, I guess, is the 950 folks, they have families as well. Yeah. So the number of people who are impacted are, it's many more than 950 individuals. So the 0.06 is a little bit misleading from that perspective. And then, the other, I think, important part is that it's not only the 0.06 that are experiencing negative consequences from their gambling, and in fact, there's more harm associated with people who are not quite at that level because there's more people gambling like that than there are people with gambling problems.
Thank you, Dave. We're going to go back. Hannah Bell, one more question.
Thank you, Chair. Again, I appreciate that last piece because it is something that we talk about. I try to talk about the number of people impacted versus a percentage because it's really hard to conceptualize that, but we can understand when we talk about 1,000 people or as you pointed out, it's families, not just that number of people. I guess a higher question around, you'd mentioned just there about we might be able to connect and track them, but there's privacy concerns in running something that's online and then where that information gets shared. So I'm cautious about thinking that we can help people if they need it through their interaction on the site because of the basic privacy. But the other piece is also, do we have any precedent for restricting access to sites based on location or being able to shut somebody's access off? Because my understanding is with it being through an internet provider, it's federally regulated under the CRTC. So I would be really interested if there has been any precedent on limiting or restricting people's access to gambling sites.
Yeah. So there's two things, I guess. One is, one of the features that I didn't mention earlier is self-exclusion. So that people can actually ban themselves from continuing to gamble for periods of time or actually indefinitely. And that certainly is a feature of many sites. People can actually just say, I don't want to gamble anymore today, or they can say, I don't want to gamble anymore for 6 months or 12 months. And that, feature is available in various ways in land-based venues across the country. It's clearly a tool that individuals use to regulate their gambling. It's far from perfect because there are challenges with enforcing it. So actually identifying people when they're entering a casino in jurisdictions outside Canada, you have to show ID, you have to have a registration card. It's less of an issue outside of Canada. In Canada, we tend to, not regulate entry into casinos in that kind of way. In Ontario, I know they use facial recognition technology to help identify people who have excluded themselves from casinos. So in some jurisdictions, though, there's third-party casinos or third-party exclusion where people can go and have a family member excluded from gambling, or a government agency can do that on behalf of people. Now, that's not going to happen here in Canada because of different values, but those are possibilities. What is the other whole approach to this is really IP blocking and really trying to block external sites. And I know that they've made efforts in Quebec to do that, and that haven't been particularly successful. And I haven't really followed the details. I'm not a privacy expert, but I think we monitor people's involvement on all sorts of things electronically. And if we're asking permission to do that, I think, I don't think we should just decide that we can't do it without really looking at the ethics and the technology requirements for that.
The new Minister for Social Development and Housing, Brad.
Oh, thank you, Chair. And I have a couple of questions. Thank you for your presentation. I just wanted to clarify, because you'd said earlier in your presentation that gambling was, quote, barely available in PEI, the online gambling that is. And was it 0.6% that you estimated based on the other maritime provinces, or was it 0.06%?
I'm just going to go back and look at that slide so I get it right.
So 0.6. Good.
So it's 6.4% nationally are people who indicated that they gambled online in the past year. And in PEI, it was 5%. so a little bit lower than the national average.
And what was the percentage of problem gamblers?
So the percentage of problem gamblers in PEI overall is Atlantic provinces overall is 0.6%, so less than 1%. These are adults age 18, and the estimate is that I don't have a rate for problem rate among online gamblers in the Atlantic provinces, but generally it's 4 times higher. Nationally, it's 4 times higher.
Brad?
So I just wanted to clarify, just to be 100% sure. So this illegal gambling, using those illegal online gambling sites, those are available to Islanders today, right?
Yeah, so I believe now someone in the room would have better information than me, but I believe that could include purchasing. I believe that somebody can go to a government site right now and purchase a lottery ticket, and that would meet the formal definition of online gambling. So some of those people are likely referring to that. Now, others, though, would be accessing sites outside the country, and the federal legislation does not make that illegal, so citizens can do that. What's illegal is that be offered. It's illegal to offer it. It's not illegal for citizens to actually do it. So some people do that. And that's actually the argument that's used with expanding it within the province, is that people are gambling on unregulated sites outside the country, and it would be better for everybody in lots of ways if they migrated back and they were gambling on regulated sites within the province.
Brad?
So I think that is an important point, because if I'm a problem gambler on PEI today, and I can't go to an in-person gambling site, or I don't want to, I can today. There's no barrier stopping me from going to an illegal gambling site. That's correct?
That's correct, yeah.
Okay. Sure.
Brad?
Yeah.
Yeah. Thank you.
So these regulated sites, like the ones that being proposed by ALC.ca, do they allow for anonymous play? Like, can I go on there anonymously and gamble?
I'm actually not sure. I'm not sure what the requirements are for registration currently.
Okay.
Brad?
I believe you can, but I'm not absolutely sure about that.
Brad?
No, and the reason I was asking, because you were having a conversation earlier about, the member here, Hannah, was talking about trying to fake logging on multiple times to get around any of these restrictions in place to minimize harm. And it sounded to me like you were kind of agreeing that is something that could happen. But that's why I wanted to verify if indeed you can go on anonymously, or if you have to register right now on the regulated sites and in the rest of Canada even. Yeah.
So I believe that you need to register. My guess is that there's probably ways around that, right? And the reason I'm saying that you need to register is that there is an attempt to do age controls. I actually don't know the details of how it's done in different provinces, but my guess is that they all require some sort of registration. And if it's not easy to get around that, it's technically possible to get around that, is what I would imagine.
Brad?
And this may be outside of your scope of expertise, but these illegal gambling sites, do any of them have some of those practices in place to minimize harms, where you can set those limits like you talked about, especially the pre-commitment stuff? Or is that something that's really only the realm of the government-regulated online gambling sites?
Yeah, so many, there's thousands of online unregulated sites, right? And some of them are regulated in other jurisdictions, so they're unregulated sites for Canadians, but they're actually regulated in other jurisdictions. So it's variable how many features they have, but most of them will have some sort of nod towards helping people not gamble too much. The jurisdictions where this has been taken most seriously are the Norwegian or the Scandinavian countries, and there, it's quite a regulated market, and it is sort of by government regulation that these services are offered, these features are offered. So in Norway, for example, all gambling is identified to the individual. So each individual has the equivalent of a card, a number, and whether they're going to a casino or playing a slot machine in a bar or going to an online site, all of that is sort of coordinated. And so the system's able to, give advice to individuals based on their entire gambling. And the individual is also able to exclude themselves from all types of gambling at the same time. So that's considered kind of the gold standard at this point. There's certain reasons that they're able to do that in Norway that would be difficult in other jurisdictions. But I think the advantage we have in Canada is that the market it's essentially a monopoly. With a little bit of slippage around the edges, but we are in a good position to, be pretty bold in what we do to help people help themselves.
Brad, last question maybe?
Thank you, Chair. So you had mentioned earlier that if you're a problem gambler, and this is the way I interpret it, like basically you're going to find a way to gamble, like you're driven to gamble. You used, I think you said some of the protections around, to try and help protect people from themselves were more like speed bumps as opposed to barriers, that sort of thing. But then you were talking about at this point 6%, which is about 950 people, which is a fairly significant number of people, but it was a little unclear about whether, on PEI you would find 950 people doing that. It seemed to, again, based on the questions from Hannah, that you thought it would, increase the depth of addiction. So like not all 950 of those people were probably gambling now, and by offering online gambling, more of them would do it. So I'm just trying to get a feeling, like right now on PEI today, in your opinion, that 0.6% of estimated people, right, with that gambling problem, what percentage of them would actually just be driven to find a way to gamble, whether or not there is an in-person available, and take whatever steps they could to get access to the gambling? Like what percentage out of 950 do you think are already online gambling?
So I understand the essence of your question, and I don't have particular percentages to offer you, but I want to kind of shift the focus a little bit, because I think these features to minimize harm aren't particularly directed to problem gamblers. So they can be helpful to problem gamblers because they may direct them to not gamble. Really, what they're mostly focused on is to have all gamblers gamble in a way that's not going to cause them a risk of harm. So they're really features for all of us who are interested in online gambling to not get into problems. Now, some of us might have a particular vulnerability and be liable to develop a gambling disorder. For others, that they don't have those pre-existing vulnerabilities, but they could gamble in ways that are somewhat harmful to themselves or to their families. So I think it's a little bit dangerous to focus just on what's the impact on problem gambling here. And in fact, I'm almost sorry that I presented those figures in a sense, because it's a little bit of a distraction. It's really about all gamblers staying within gambling in a style that's not going to cause themselves harm. So in the same sense that our alcohol laws are not focused on alcoholics, they're focused on people drinking alcohol and helping them do it in a way that's not going to cause them harm. So you can't, drive when impaired. That's not just an issue for people who are alcoholics. That's an issue for anybody who drinks and needs to transport themselves home. And so our laws are really, focused on that. So it's the same with the online gambling area, that these harm minimization features are really not about problem gambling. It's about gambling. Does that make sense?
That's great. We have about just a little over 5 minutes left to go, so tell them the committee members. So just keep that in mind. Peter?
Thanks, Chair. Thank you for the presentation. One thing I'd like to chat about quickly off the top, I understand we're getting short of time here, is the very common practice of under-reporting of gambling. If you look at the ALC numbers here, the number of people or the amount that people claim to be spending on gambling is about a sixth of the income that ALC sees every year. So there's some significant under-reporting. Given that that's borne out in studies, how confident are you that the figures you've been presenting today are actually accurate figures?
Yeah, it's a really good observation, and the reality is that we've done in the last couple decades, really, we've done a lot of work about the best way to ask questions to get the most accurate response, and it's challenging because you ask somebody how much did they spend on a VLT machine, on a slot machine, and is that how much they took to the is that how much they put into the machine? What if they won $100 and then they reinvested that? And it becomes very complicated very quickly, and you're asking people then to report on the last month of their gambling, and so there's lots of room for error. And so we know that there's error, and the error tends to be that people don't remember all of the gambling that they've done. And so there's still, even though we've improved a lot, there is still some underreporting. Same issue with alcohol, our smoking rates, like all of our attempts to measure, population level involvement in different behaviors have this same problem. So how, we try to validate it by looking at, sales figures and industry data and so forth. Again, the nice thing about online gambling is we could actually look at, individual level expenditure and involvement in a much more accurate way than we could by just asking people through surveys. So we're kind of moving in the right direction, but you're absolutely right. These figures are probably underestimated, if anything.
Peter?
Thanks, Chair. The annual revenues to Prince Edward Island from ALC are about $18 million. 11 million of that comes from VLTs. Of course, we don't have an online component yet, but government wants that to be a part of this mix. Of that 18 million, we currently spend $200,000 on supports for problem players. And just last night on Compass, which is our evening local news program here, I saw an ad placed by ALC offering $20 of free play, and I noted in your presentation that you said that's one of the things that we absolutely shouldn't be doing. Could you give us your thoughts on whether this is something, and I know we've heard from other people in the room previously that, well, this is going to happen anyway, so why not make it a regulated site that government or a government agency can control and regulate? But here we have a government agency actively encouraging islanders, and many of those islanders may be recovering addicts, to go and play. Can you give us your thoughts on whether that's a responsible thing for a government agency to be doing?
Yeah, so I think it would be helpful if the regulation were separated from the operator a little bit more clearly. I think that's a general dilemma that we have in lots of provinces, and I really don't know the PEI situation at all, so I'm really talking much more generally. So I think, you know, having good regulation and oversight separate from the profit motive is helpful. And so, you know, the example you give is probably not the best thing from a responsible gambling perspective, to be enticing people into the market in that way. And you're right, there's going to be a few people that who are in recovery from gambling problems where that's going to be a particularly challenging or somewhat challenging kind of experience. The reality is that, you know, recovery is all about resisting those things. So, you know, if, like, we shouldn't be promoting it and adding to it, but that individual is needing to resist all sorts of stimuli towards gambling effectively if they're going to be successful. So, I'm not particularly worried about one individual with that happening, but generally, yeah, no, it's promotion of the, we have limitations on advertising for alcohol and cigarettes, and our gambling. I think we need to be very thoughtful about what we allow to be advertised.
One more for Peter, and then we'll move on and take a couple questions after that.
Thanks, Chair. One of the other consistent statistics around gambling is that it's done proportionately by low-income people. And if you look at the percentage that of people's incomes that they spend on gambling, it gets proportionately higher the lower the income you have. That was poorly worded. The next presenter here in front of the committee is from the Mental Health Department here in Prince Edward Island, and clearly COVID has created new stresses for all of us, even particularly those with underlying mental health problems. Gambling addiction has been shown to lead to approximately, the last statistics I saw from a couple of years ago, about 300 or 400 deaths per year by suicide, directly or at least largely linked to gambling addiction. That translates to 2 islanders every year taking their own lives because of gambling problems. And I'm wondering whether you have anything to say on what supports government should provide, given that we spend so little on supports for problem players now. How can we support those people who are vulnerable to start with, who spend more proportionately of their income than others, and who need government supports in order not to end up in that terrible place? What would you like to see governments do and spend money on in order to support problem players?
Okay, so you just cited some figures of the profits from VLTs. What were they?
11 million per year out of the 18 million that PEI takes in total from gambling. Okay,
so the 11 million, something like, I don't think this has been calculated specifically for PEI, but somewhere between 30 and 50% of that come from people with gambling problems. So right there, you could suggest that the amount that then is redirected towards prevention and treatment and research is inadequate. So, that would be the first, broad kind of statement is, put resources into it. I think some of the resources need to be focused specifically on how we offer gambling in ways that will prevent harm. I think, though, that you're right that the individuals who are most likely to develop problems are individuals that there are social issues and mental health issues and other issues that if we did a better job of handling those, the possibility that they will gravitate towards gambling as a way of living their lives and dealing with these issues is less. So I think, it would be it would be dangerous to kind of view gambling in isolation. It sort of needs to be viewed in the context of all sorts of social health and mental health kinds of issues. And I think, you know, some of the funding for that should come from recognition that profits are coming, a disproportionate amount of the profits come from people who are suffering harm from what we are offering them, what our governments are offering them.
Thanks, David. We just have one time for, you're fine? Okay. Well, okay, that's okay. What we'll do is, we really appreciate your time today, and it helped put this in context, and it's amazing that you were able to spend an hour with us, and it was really very helpful. So on behalf of the committee, David, I'd like to say thank you for joining us, and we'll continue to work on this file.
Okay, pleasure, and happy to provide any kind of other insights as you go along.
Great. Thank you very much, Doctor. So we'll take about a 2-minute break to figure out our next presenters, and we'll be back. Okay, we're back to move on to the second part of our presentation. So I will pass it over to our guests to introduce themselves for Hansard, and then they can continue on with the presentation or discussion, and then we'll ask questions at the end. Okay, over to our guests.
Hi everyone, my name is Thibeau. I'm the Acting Executive Director for Mental Health and Addictions for Health PEI. Hi everyone, my name is Nora McCarthy-Joyce, and I work at the Department of Health and Wellness. I'm Community Relations Specialist there under Health Policy and Programs, Mental Health and Addictions.
Perfect. And then do you guys have something prepared to go through, or are we just going to ask questions?
Questions would be great.
Oh, okay.
Yeah.
Okay, I didn't check with the committee first.
Yeah.
So I guess continuing on from our last presenter, it's an open floor for the next bit of time to ask questions to our two guests. So, Heath?
Is it possible just to give us a little overview of what your positions entail, maybe in relation to what we're talking about today? Would that be fair?
Sure, of course. So as part of mental health and addictions, we have people that come to us that may be experiencing harms from gambling, or their family or loved ones may also need some support. So across the island at our sites, our clinical staff are trained to support those people, again, the clients or their families. And we also have, a variety of ways to support them. We have one-to-one sessions, we have group sessions, we have the helpline, of course, that people can call for immediate service. And so across all of our spectrum, our staff are, monitoring and screening for people that may be struggling with gambling issues, and then providing those services as needed.
Heath?
So the emphasis basically is, from you, is not basically on what the issue is, it's actually the result of the issue. So, okay.
We just want to make sure that, we can keep Islanders healthy, and that we need to be a part of that to be able to respond to some challenges that might arise, but also hopefully be part of that prevention and early intervention as well.
Heath?
What demographic, male, female, what percentage roughly would you deal with as far as, is it more male or more female?
I think the numbers vary. It's probably more male. And our numbers, can fluctuate throughout time. So we might see across the island a couple hundred people potentially at any given time that might be experiencing some level of harm. But again, that can change as people's needs arise.
Perfect. Trish?
Thank you, Chair, and thank you both for being here today. So in the last presentation, we heard that online gambling increases the risk of problem gambling by 4 times. That it's 4 times, I believe that's what he said, more likely that problem gambling will occur. So something along those lines, 4 times more risk. So. When you're supporting individuals who are struggling with gambling addiction, do you feel there is a risk of introducing additional access to online gambling?
So like anything, the more that things are available, of course, it can potentially increase harms. All of our clients who would be partaking in online gambling now would be using just different sites. So that's something that often clients are already partaking in. But it's really important for us to be able to respond to that. And again, I think that's part of that early intervention and doing that education with clients, kind of helping them monitor their play and having them understand those risks. Clients may not be aware that, going online might seem more convenient, and they may not be aware that there might be sort of those inherent potential additional risks.
Trish? Oh, sorry. Go, absolutely.
I just wanted to add something to that. Something that we often don't consider in terms of gambling and in terms of harms is the whole notion of harm reduction. And while for some, having access to online gambling can be a protective factor, but for others, they may use it as a harm reduction measure. I've actually been talking to local gamblers in PEI who sometimes will use free gambling games online as a harm reduction measure. So what they describe is that they have an urge to gamble and that they're using the online games, the free games in particular, as a way to kind of get through that urge without actually spending any money. And if you do a little search online, there's actually thousands of free games. And again, it's just something in terms of considering this in terms of both a protective factor and a harm reduction measure all at the same time, depending on the person. Some other variables that people may want to think about or consider is, what is the intensity of play? What are the patterns of play with this individual? What are the other comorbidities that they may be dealing with? So for example, if someone is experiencing alcoholism and are gambling at the same time, the likelihood of making a poor choice is probably high. Similarly with a mental health condition. But if you're in recovery and you're trying to protect yourself from going down that path, perhaps free games online may be somewhat of a harm reduction / protective factor for that individual as well. So there's so much variation that we have to consider.
Trish?
Yeah, I think that's a really interesting point. And, of course, that's not what, we're talking about here, though. The government is not partnering with ALC to create a free, gaming site that will result in harm reduction or with the goal of harm reduction, or even, with any, other goal around social connection or anything along those lines. We're talking about a for-profit online gambling site. So, so that's really sort of the core of the issue here. I don't know if I can ask this, to be honest, but I'm just going to try and we'll see what happens. Was either a health PEI or experts in the department, anybody consulted in this decision that was made recently by Cabinet around allowing the online casino? Were any recommendations provided to Cabinet about that decision?
Certainly, I wasn't personally consulted, but I know that there were, and I think you'll have an opportunity to chat with some other policy people within the Department of Finance who were consulted and working in this area as well.
Trish?
And is that the same for Lisa for health PEI and mental health and addiction?
Wasn't directly consulted, so I can't speak to if someone perhaps else was, but I wasn't directly.
Trish?
Thank you, Chair. So individuals within the Department of Finance, but not in any areas of health, is what is perhaps. Okay, fair enough. Okay, that's all for now, Chair. I'll let others ask.
Perfect. Anybody else? Heath? Yep.
So you theorized there on possibilities of this, or is there any impact evaluations that you do on, if we take an average family of Prince Edward Island, 2.8 people, that's 3 people. Dr. Hodgins said it's 950, so we're talking around 3,000 people affected. Is there any sort of, how do you do the impact evaluation of of those situations?
I think that realm is quickly evolving. Certainly COVID has shone a light on many of these issues, and I think one of the key messages here is that as a government, as a society, we need to respond to these COVID-related issues that are being brought to light and develop the capacity to respond to those. And that's an ever-evolving situation, specifically with industry being so quick to maneuver and being so nimble in terms of new games being produced and that sort of thing. So I think that's always evolving. Certainly in the past there have been prevalence studies done here in Prince Edward Island. We actually just recently commissioned one, and we're hoping to have results for that this year, and hopefully that will shed some additional light on this situation, if not create a benchmark from which to continue the work from.
Heath? Study is in the process right now?
They're in the process of reporting on that study. Yep.
Heath?
So there's really, it's the problem, the scope of the problem is problematic because there was really there's no criteria there to evaluate what a new game is going to do in offshore gaming with larger bets and so on and so forth. You're doing your job because when they come to you, you're trying to fix the issue.
I think we work under a number of pillars. One is prevention, for sure. Education, chatting with people, doing local research, which I advocate strongly for, is of utmost importance if we're wanting to understand this issue in Prince Edward Island, and we're going to want to respond to this issue in Prince Edward Island with a PEI response, a made-in PEI response, one that is relevant to the users of the services and programs that we provide. So I think that that's an ongoing process. Just recently, last year, just before COVID actually, we did some local focus groups, and certainly that is very informative, and I think that work needs to continue in order to understand the situation in Prince Edward Island. And of course, now that COVID has happened and we're still in the midst of that, we have to understand that there's so many variables there that are still moving and changing and evolving, and those are all important factors. So the research needs to be ongoing.
Heath?
You're reinforcing what I'm saying is, for government to implement a program without consulting fully on what you're telling us in your expertise advice is surprising. I guess that's what I'm trying to say, because exactly what you're saying is likely would have been the impact evaluations and the criteria set around it to resolve some of the issues of the people that you deal with. So that's kind of, I guess, what I'm agreeing with you. I'm just disagreeing with government implementing it in the midst of COVID-19 and not consulting with the professionals prior to. If your study had come out and they were allowed to sit down and say, whoa, guys, we better take another look at this, it would have been a much easier decision, forward or backward, whatever the decision may be. So I find it very interesting. I was in a position and refused this game twice. And it was very interesting to see the reaction of government to implement it silently on December, right before Christmas, but not consulting with you or possibly the new minister's department is very interesting. Thank you, Speaker. Thank you, Chair.
I just think it's a quick response to that in terms of, how can I say this? Our modern world is internet driven. Not only has online gambling taken precedent in recent time, but also our response to gambling has gone online. So in other words, treatment options. And I think sometimes we miss the fact that we need to meet people where they are and not where we want them to be. And if they're online, and the research tells us that they're seeking self-care first as a first form of information, then we need to meet them there with our response. And I think that both the Department and Health PEI have done a lot of work during COVID in particular to pivot and respond to that with virtual health and telehealth options and that sort of thing. And that's not just for a gambler, but that's for anyone with mental health and addictions struggles. And perhaps, I'm not sure if you want to speak more to that, but.
Sure. Just so that you're aware, during COVID, we were able to move more online, and so we were able to offer Zoom and telehealth and phone sessions to clients, one-to-ones and groups as well. And so gamblers, people who struggle with gambling may not always want to come forward right away to seek help. And so for us being able to, again, like as Nora said, kind of meet them where they're at and provide them with some of those online tools and, tricks and tips and, things that they might be able to use in some of that harm reduction, as well as having them identify whether, is this a problem for me and do I need to seek further help? We've just launched Bridge the Gap, which is a new online platform that people can use, and we're exploring some different apps that we can add to that are gambling specific that might help people, start that process.
The other thing I might add to this is the fact that, gambling has been happening online for quite some time. In actual fact, it's been decades. And the lines between gambling and gaming are often blurred. And, a wise person once said to me, we've gamblified gaming and we've gamified gambling. So in terms of that whole scope, I think people are playing online. They've been there for a long time, and they do it for all sorts of reasons. And so, I think our job in health is to focus on health in terms of responding to their needs if and when it's needed. The other thing we need to consider is in terms of prevalence. Our last prevalence study, while outdated, I think it was back in 2006, and it was done by Dr. Jason Doran at the University of Prince Edward Island. And at the time, the gambling prevalence for problem gamblers and PEI was around 2%. And worldwide, if we look at the figures, it's between 2 and 8%. So we're on the lower end of that scale. But what that also tells us, if we look at the flip side of that, is that not everyone struggles when they choose to play this form of entertainment. And so I think, in terms of balancing out our perspectives on what this looks like, we also have to keep that part in mind. I agree with Dr. Hodgins. I was able to watch a little bit of his presentation in terms of, education is really important. Informing people is really important where they are. I think it's irresponsible not to give people good information right where they are, right where they're sitting. With the advances in technology in terms of game design and also the availability of cell phones and tablets and things that we have straight in front of us, it makes sense to make sure that people have access to good information right where they need it. So it's just a consideration in terms of this issue.
Heath?
So budget is just around the corner. So have you requested additional funding, or has there been any discussion in additional funding for what you're doing, relevance to these new announcements?
I haven't personally asked for additional funding, although I do think that as this evolves, that's something that needs to be flexible. Certainly, we receive $305,000 a year currently. We are a unit of 2 people, and we do quite a lot in terms of prevention, education, treatment, and aftercare, with a large research component throughout. I really believe that the research component needs to continue. We also support Health PEI and their clinicians in terms of up-to-date information. So before Christmas, I was actually in current discussions with a professional in Ontario to offer webinars on the actual the situation of COVID-19 and gambling, so that our clinicians can be up to date and they can know what has changed and what types of things they need to look for in terms of not only helping people identify if they have a gambling problem, but also dealing with the gambler themselves, their family, and possibly even the community in terms of programs and services. We actually work quite closely together to make sure that the work that's being done is very relevant and meets the needs of people as they approach us and access care.
Consider as the 300,000, and then what would the numbers that we've talked about, and I think Peter mentioned them earlier, was 18 million. And that 300,000 is a pretty small number to do what you guys are doing, based on obviously the issues that you're being faced with. And if that continues to grow, we'll certainly advocate for more money for you, but more consultation from government on this issue. Thank you. I'm fine.
Great, perfect. Hannah?
Thank you, Chair. So with the previous presenter who was referencing the 2018 study from Stats Canada, the Canadian Community Health Survey, there, we were talking about identifying problem gambling, in that case is 0.6%, and that was equivalent to 950 individuals, which was pretty shocking. But now you're telling me that you're working with numbers around 2%, which is over 3,000 people, and that's people. So it's not a number, a percentage, it's 3,000. You're working with maybe a couple hundred at a time. Those are huge numbers of people who have a huge problem. And I'm really struggling with an approach that says, well, they're going to do it anyway, so we may as well get some money out of it. It feels really imbalanced with sort of speaking around mental health and addictions, and recognizing that we have a population, whether it's 950 or 3,000, either of those numbers are really not okay. And that at the same time, we're okay with investing in programs that are actually going to provide more opportunities for people to become another one of those numbers. So I guess a couple of questions. You said that you really do a lot of work, a lot of research, which is fantastic. What's the research that you have around the number of problem gamblers who are currently online in the existing available sources? And how many of those people do you see through your programs that you offer?
I think the best people to ask around that would be Atlantic Lotto, because, they would certainly have perhaps analytics on who is playing and how long they play and those types of questions that may make a difference to firmly answer your question. Unfortunately, we don't have access to that data. Our research, like I said, is around those 4 other pillars, which is the kind of the prevention piece, the treatment, the aftercare, and that sort of thing. So we've been really working hard to do a lot of outreach, do a lot of education in the community, normalize the conversation around gambling addiction, because there is a lot of shame and stigma around gambling addiction. And specifically, it comes because oftentimes individuals may find themselves, stealing from family members to support their addiction, or perhaps spending the family savings or retirement, or remortgaging a home. And these are some of the more severe cases. And certainly, there comes with that a lot of shame when you know that, you're not only hurting yourself, but now certainly you've maybe changed the trajectory for your children or for your spouse or your partner and that sort of thing. So I think the research that we do, unfortunately, we don't have access to those analytics. But perhaps as COVID evolves, ALC may be able to provide that type of, and I can't speak for them, but perhaps they would be best to ask that question to in terms of receiving that information.
Hannah?
Thank you. So that's a bit challenging because obviously, we're talking about ALC, in this case, bringing forward a product that hasn't previously been available. As to my colleague's comment, it's been raised a number of times, but the current sort of ALC online space is not, a full online casino, which is now what's being proposed. The reason I'd asked about the research was a couple of things. You had mentioned it yourself, that you're making informed decisions for program development based on good research. And so clearly, if you're working with people in the community, then you're going to be working with them and they're going to be telling you where they are spending time online. And you yourself mentioned that they are spending time online. The other side is I don't really understand how you can make prevention or treatment programs for people if you're not making those based on evidence. So if there is an online gambling problem already, in addition to VLTs and all the other pieces, that data wouldn't come from ALC. That would just be usage data. What I'm asking you about is how do you design programs and services to address the problems that people are currently experiencing if you're not collecting that? You must be basing that on something, and you've spoken about online gambling as a something.
Right.
So what does that look like?
Yeah, it's a variety of research techniques. Obviously the focus groups are very informative. Certainly stakeholder engagement is another piece of that. So having conversations with ALC and that sort of thing in order to gain more information and more insight into where industry is going. Keeping up to date with, current research in Canada and around the world is a really important piece of this. I think that what you're speaking to certainly is kind of these COVID-related concerns that we're seeing everywhere, and certainly the evidence exists for that. And what I'm saying is that while we know that's there, I feel that we need to be asking consumers and we need to be doing more local research to find out what the PEI issues are. Because certainly it wouldn't be sensible, I don't think, to assume that, like for example, we take New Zealand and Australia, they have some of the highest rates of problem gambling in the world. It wouldn't be sensible or even appropriate to take the information that we garnish from the research and the funds that they've put into research and development there and simply just kind of place those programs and services here in PEI. So we're on a trajectory and in a process where we are looking to do those things. And as I said, the prevalence report data should be, and report should be ready this year. We'll be happy to share that when that data is available, or when that report's available. And also we're doing our own local research, and we're going to continue to do that because we believe in it so firmly. Really and truly, you know, gambling, like I said, affects not only the individual but the family and the community. So those levels of research need to be considered.
Hannah?
Thank you. So following on again from my colleague Heath's point, this online gambling agreement was set in December. We hear that you weren't consulted on it, but obviously you're aware of it coming. You haven't necessarily got anything in place right now to address that, so I recognize the need to sort of build and develop, you know, research pieces, but you don't have any space for that in your budget currently.
Well, interestingly, I think that, you know, we've always actually been quite well prepared for this. And I think it goes back to the whole notion of when gambling went online, so did treatment services. Health PEI has just been tremendous in their ability to pivot the entire service realm to be able to, for people to be able to increase access, really, for people across the island to access services while we were in the pandemic. So, and as I sit on the FTP table for mental health and addictions and speak with my colleagues across Canada, I can see that we are we're well established. We've come a long way here in PEI. If we go back to the asylum days and we look at how far we come, you know, it's quite amazing what a small province and smaller numbers of people can really accomplish. But yet we have a long ways to go. And this is one of those kind of ever-evolving pieces that we're going to need to navigate. And that's a continuous process. It's something that certainly we need to develop the capacity for, and we're going to continue to develop the capacity for.
Hannah?
Yeah, Chair, so perhaps I can finish the rest of my sentence, which was that given that we are in COVID, which obviously brings a huge number of stresses and strains, not just onto how we deliver services, but also the amount of services that are required. I'm really concerned and hopeful that you will ask for an increase in your budget to allow for the provision of additional services that are going to come from the implementation of this casino in the time of COVID, and to support the research that you're going to need quickly to respond, because you know, I'm hearing that you're meeting the needs of a few hundred, which is fantastic, but we're also hearing about the problem sits in the thousands, not in the hundreds, and we don't know right now what the longer term impacts of COVID and isolation and all those other pieces are going to be. So it would be to you know, really kind of follow up on the ask there, which is, it is not too late to seek additional support, because frankly I think we're going to get hammered, and I am really concerned, but I don't want us to be in this committee, you know, in a year's time saying we should have done something. If we're not able to stop the casino going live, we need to prepare for the impact of it, and that was the second piece in there. So thank you, Chair.
Thank you. Great. Zach?
Thank you, Chair. I'm glad that you did have a chance to see Dr. Hodgins' slides. I don't know if you got to see that. One that came to me, I really had no idea, but I think he had mentioned that gambling generally, I know it was small percentages, but is down from the survey from 2002 to 2018. I'm just wondering if that would be your observation for PEI as well?
To the research, I mean, there's suggestions that land-based gambling is down, but certainly during COVID-19, many casinos closed their doors, which of course is extremely preventative in terms of gambling addiction. However, people have migrated, and certainly we all have a cell phone, and you know, it's right here, and it's right here 24/7. So access is an issue for sure. Yeah, I mean, what I'm seeing generally speaking is that internet use is up, but of course it's up for everyone. whether you're seeking to play a game or whether you're seeking treatment. People are online, and I think that's a global trend, and that's not going to change anytime soon. If we think about COVID-19 and the impending fear, there's a number of variables there. There's the impending fear of whether or not we're going to go through this again, either with COVID-19 in a second, global wave, or perhaps even with a whole new virus, a whole new strand, and of course, businesses and health authorities are preparing for that by going online. And again, it does help to meet people where they are, because we know people are online. If we each monitor ourselves and how much time we're online or in front of a screen each day, those are all opportunities in terms of accessing services or accessing games. So I would say globally that is certainly the trend. Whether or not that will be maintained post-COVID, depending on whatever that looks like, again, that's a variable that we don't know, is another factor. The other thing you have to consider is why people gamble. Some people gamble because they're lonely. Some people gamble because of social isolation. Some people gamble because they're wanting to chase losses. Some people gamble because they are wanting to or look at it as a source of income. So we have to consider that. We have to consider the intensity of which people gamble, the types of games they're playing, the integrity of those games, certainly how much they spend, whether or not they're setting limits. There are so many unknowns in this realm, and really, there's no way to get ahead of that. There's no way to, tell the future. But certainly we can be ready to respond if and when someone needs us. And I feel like in health, in particular, that's what our focus is if and when somebody is reaching out, that we have not only the services accessible, but certainly that they are the very best services that we can offer.
Zach?
Thank you, Chair. So I know it's hard to imagine the world pre-COVID now, because it feels like we've been living it for so long, but pre-COVID, again, based on that study, was more of up to 2018. So was there pre-COVID, obviously more people are online now, they're not going into casinos. Do you have an observation on whether gambling was down on that period pre-COVID? I'm just using the Dr. Hodgins' numbers that he had said from 2002 to 2018 when that survey was taking place, that generally gambling was down. I'm just curious, pre-COVID, if that would have been the...
I think so. And that may be another question again for ALC to give some really kind of hard data and analytics to that question. But certainly, land-based casino use, I think, is kind of on the decline in terms of the word I'm looking for is not access, but convenience. It's more convenient for people to use online gaming and online gambling, just like it's more convenient for people to use online treatment and services and programs. And so, what I see in a balanced way is that both things have gone online. And again, not everyone is going to require them. Not everyone is going to access them. If we want to increase access, we really do have to look at the shame and stigma associated with gambling. And of course, that's a piece of work that I've been focused on and kind of working towards over the next couple of years, putting into the planning for that work. It's certainly a piece that we need to look at.
Zach?
Thank you, Chair.
Oh, that's okay. I thought you had another question. Michelle?
Thank you, Chair. And thank you, Nora and Lisa, for joining us here today. So I deal a lot in numbers, and I think that it's very, we tread into very scary waters when we talk about people as statistics, as percentages. And so I appreciate that Hannah brought us back to, this is 950 people when we were speaking to Dr. Hodgins. But we're talking more of 3,000 people, I think, from what you were saying of who you're working with. And then we talk about their families. That's a whole other level of people, and it's people we're talking about, not percentages. and not just numbers that are in a report or statistics. These are people and their livelihoods and their homes. And so I think that it's really important that we don't disassociate ourselves with who we're talking about here. And I think what you just talked about, why people gamble, and you talked about something that's near to me, and loneliness. And you know, when the Minister of Finance spoke to COVID is the reason why we're going online, because more people are gambling. I worry when we don't look at what the root cause of things are and we only treat the symptoms. Because if you don't look at what the root cause is, you're just going to continue to treat symptoms. We're going to continue to throw money at a problem that we're never actually going to fix. So you listed off a number of reasons why gambling was concerning. Can you talk to me about some experiences? Obviously, I'm not looking for you to invade privacy issues or anything like that, but the extent that people's issues go, because gambling is not just a mental health issue, it's a social issue, it can be a justice issue, and it can cross many departments. But can you talk to some of the stories and some of the experiences that the people that you're working with are talking to you about?
I don't like to share personal stories, even in terms of gambling, because of the shame and stigma that's associated, but also because PEI is an awfully small place. And you know, let's face it, we all live in this community. I'm pretty sure that I've even seen all of you before in passing, and so you know, in the interest of not identifying anyone, but what I will say is that, you know, gambling can cause harms, for sure, and we know that. I think that the research is pretty clear. But we have to balance that with some form of evaluation around what is the situation right here. You know, we know that it's dire in some other areas, and there's a number of ways to respond to that. But again, our focus is health. So I'm concerned with the health. I know that the social and the psychosocial and the environment and all those things, there are many things that we can do in those areas, but our focus is health. So I have to kind of, that has to be my main priority, and as well as Lisa's main priority as we kind of go forth in terms of our response to gambling addiction.
Michelle?
Sure, and I can understand. But we also talk about health and wellness is what the department is. It's no longer just health. And wellness is not just how somebody's physical health is, it's how they overall are. And all of these departments all interconnect with each other. So when I'm not asking you to tell me individual stories, I'm saying, are you dealing with people who have just gambled their rent away? Are you dealing with people who are now going through a divorce because the family has been dealing with gambling addictions for so long that it's just broken up families? That's what I'm like. We can collect data without you know, identifying somebody's information, like personal information. That's something that we can do, and I think it is so important that we put stories behind the 3,000 people that we're actually talking about, so that we don't just say, oh well, everybody's doing it anyway, so let's just, you know, let's get on the bandwagon and you know, I guess contribute to the amount of dollars that the province is bringing in gambling already. So this is near and dear to me because I was a bartender. I've watched people who've played VLT machines all day long and they've lost their entire paycheck. I think it's really important that when we talk about what are some of the systemic issues of why people are gambling, we don't talk about that just as a, oh, they're lonely or, oh, they're disconnected. We talk about how do we fix those systemic issues so that we can actually stop treating symptoms and we treat people's entire wellness. And I struggle. I'm passionate about this whole issue because I know the impacts that it has on families as a whole and people's wellness. And I'm concerned when we disassociate that we're actually talking about islanders, individual islanders with stories.
I
agree with you in terms of collecting stories. I mean, I think that's why we decided to do focus groups, because we did want to interact with people who this was real for. This is real life. And we wanted to know, how are you doing? How did you, what happened to you? And certainly get feedback on what we can do better. And I think that that's one of the kind of key pieces for me personally is how do we do better on this each day? How do we do better on this each week? How do we do better on this each year? And certainly that's always a focus. I would think that, some of the situations that you've mentioned, those are common, whether you're talking about, PEI or you're talking about Ontario or you're talking about New Zealand. You're going to find people in those situations. But again, do we treat it the same way? Precisely, or do we go to the local level and find out what's needed, what response is warranted, and what's wanted? We need to find out what people need. So I think going back to the consumers and chatting with them and doing some work around this in terms of the COVID realities, because that really is what spars, I think, a lot of this on is in terms of, We've already had or seen mental health and addictions issues in PEI, as in every other jurisdiction in Canada. But now what we have layered on top of that are these COVID-related issues. So we're right in the midst of that still. Everything is still changing and all these variables are popping up. How do we create the capacity to deal with that? And I think that goes as far as, dealing with the comorbidities that many of you have mentioned, but it also goes down to kind of having gambling-specific information and available and ready to go if and when somebody's reaching out for it.
Michelle?
It's a quick answer, I think. Knowing that this type of issue crosses so many different portfolios, do you have any working committees that are looking at the overall picture of gambling and how issues such as this can be worked on? I'm just wondering if there's any active committee across departments.
Certainly the mental health and addictions FTP tables are very active in terms of national level. In terms of interdepartmental, I'm trying to think if there's any that I'm not personally involved on any right now, but again, we're in the midst of COVID. Everyone's kind of had to do their part and pitch in on the kind of the COVID response for sure. That's not a bad suggestion. Perhaps that's something that can be created. Certainly a regional level, I think policy group would also be beneficial.
Can I just add to that?
Absolutely.
So again, not specific, but on the treatment side of things, we are working very closely with those other departments because people holistically need to be taken care of, right? And so we're coordinating with them on housing and finances and all those other pieces as part of their treatment, not just what they specifically arrive to our door with.
Perfect. Thanks, Michelle. Peter?
Thanks, Chair. We're talking about this today, and you were invited in the previous speaker because government has made a decision to embark on an online gambling site here in Prince Edward Island through ALC. And there was no public discussion about that. In fact, there was no mention by government at any point in the last 2 years that this was something they were even considering. So there's been no public debate, there's been no debate in this House, and no public consultation. And I understand from the very first questions that were asked of both of you that neither of you was actually consulted as to whether this was a reasonable decision or not, although you did mention the people from the finance department were. We know that approximately, and this is based on what ALC has told us, that the government stands to make about $750,000 profit revenue from the first year of operating this casino. So clearly, this is a financial issue, and the finance department was consulted with, but it's more complicated than that. Government is really, in many respects, in a conflict of interest here because we're dealing with the well-being of individuals and families and communities, as you have said. And I'm wondering, my first question is, if neither of you was consulted in the mental health side, is there anybody else in your department that you feel would have been more appropriate for government to have spoken to? Probably Lisa would be the one to answer that question.
I really can't speak to who that they felt like they might have needed to consult. I can only say that I wasn't personally consulted.
Peter?
So, government, and let's be clear here that this is a real ethical dilemma for governments, and from our previous presenter, it's clear that he was not keen on one of the aspects of this, that ALC is currently already putting ads on Compass, handing out $20 free coupons for people to come in and do this. Recovering alcoholics are not offered $20 coupons to go into liquor stores here on Prince Edward Island, but government is actively encouraging islanders, many of them perhaps vulnerable islanders, to do exactly that when it comes to gambling. And before anybody else in this room becomes too virtuous, let's remember that a much larger gambling scheme under a previous administration, e-gaming, was jumped upon and promoted and moved forward very actively. So let's remember, this is not the first time that we have had a large online gambling proposal brought forward by a government here. The last one failed, of course, and I'm wondering whether there is, again, anybody that you can think of in the health department, let's even go wider than that, who either should have been contacted or, as far as you know, was contacted regarding this decision.
Speak to that personally, and as I said before, it's I wasn't personally contacted, but I mean that doesn't mean that contacts weren't made. Certainly, there may be someone better to address that question to at some point.
Peter?
Yes, I agree with you, Nora, and hopefully we'll have an opportunity to do that before this decision becomes a reality. There were apparently 2 studies done, independent studies done, that were provided to ALC when they made the recommendation, or actually they've been trying for over a decade to get Atlantic provinces to go ahead with these online casinos until very recently without any success. New Brunswick, of course, signed on last August, and now Prince Edward Island has. So this is something that ALC has been pushing for a very long time. The only information that we have that's cited to say that there's actually no problem associated with this online gambling platform comes from ALC itself, who again have been promoting this for over a decade now. Did either of you see those studies on which ALC based its recommendation?
Not. They haven't been shared with me directly from ALC, but certainly throughout our research, we've seen a number of studies that speak to both the harms and the protective factors in terms of online play. Yeah.
I would echo what Nora said.
Peter?
So, no public consultation, no debate in the House, no access to the only 2 studies which are supporting the efficacy of this, and so you can probably understand why we as legislators are a little concerned about the situation that we find ourselves in, particularly when we are being contacted. I can't speak for everybody sitting in the room right now, but as a Green MLA, I've been contacted by a large number of people who have concerns about this. So it's our duty to bring those concerns to the floor of the House, and this is perhaps the only opportunity, well, certainly to this date, that we've had to do that. One of the real problem elements of gambling, and Dr. Hodgson mentioned this, that online gambling leads to problem gambling. It's not one of the low-risk activities. It's a very high-risk activity. And VLTs, similarly, are the sort of crack cocaine of gambling. Here on Prince Edward Island, we have a very large number of VLTs. I know they've been removed from some places, but not all. Again, one of the consistent recommendations that we hear from people who are concerned about gambling and problem gambling and the impact it has on individuals and families and communities is that VLTs are sort of in a class of their own. They're programmed in a way to actually encourage people to keep playing. It looks like you're almost winning, so you keep going. has there been any contact between you and anybody in the finance department as to express your concerns specifically regarding VLTs, which of course will be a large component of the online casino should that go ahead?
Certainly, I mean, I've been in contact with folks across departments with regard to or reducing the harms associated with problem gambling, and that's consistent over time. It's part of the work that we do, is having those conversations and normalizing the chat around gambling, and now, of course, online gambling as it's evolving. How can I say this? The point I was going to make has left me. Sorry.
It's okay. Yeah,
If you could just reframe maybe the last part of your question.
Sure. I was wondering whether, given the sort of enhanced or magnified effects that VLTs themselves have on problem gamblers just because of the nature of how they're programmed. I was wondering whether you or anybody in your department had ever made recommendations to government that they should further limit the number of VLTs or perhaps remove them completely from sites on Prince Edward Island.
I think one of the things we do, again, have to consider, and I'm being devil's advocate here on both sides, because I'm trying to maintain a very balanced approach and in terms of looking at gambling. And I think that's very important, because when it comes to decision making, we really need to focus on evidence we have at hand, whether that's, the stories from individuals on the island or whether or not that's data driven and analytics. And so, when we think about gambling, what's interesting to me about gambling, as opposed to some of the other addictions, is some of the presumptions that are made around gambling. So in other words, one of the presumptions around gambling is that everyone who gambles is going to end up playing that type of a game, and that's not true. It's perhaps more true, the risk is greater for those who are already online and already have moderate to problem gambling tendencies. However, not everyone is going online to play some of those more kind of high stakes or high risk type games. So I think when we do talk about this, and we do, just for consideration, we do have to consider that not everyone is going online for the same reasons, for the same amount of time, for the same intensity of play, for the same game, for the same, or even has the same access. There are still people out there who don't own a telephone and who don't own a tablet and prefer kind of the land-based games. So I think we do have to check our presumptions sometimes around that. It's not fair to say that everyone who goes online is going to go online and play a VLT type game or a casino type game. Far more might be going on to pick up a lottery ticket or do other forms of play online. So I just wanted to kind of put that point out there as kind of something to consider. Yeah.
And I don't disagree with you at all. One of the big differences, though, between, and we still don't know what the parameters will be of this online casino here on Prince Edward Island, but the one that's been established in New Brunswick, the only other one in the Atlantic region under the auspices of ALC, has very high individual betting limits. Typically in a VLT, in a Legion or something here on PEI, they're very low limits. A couple of dollars is all you can play at one time. But the online casino in New Brunswick has single bets on VLTs up to $100 and single hands on blackjack. And again, I agree, it's not all VLT, but it is all virtual. And let's remember that they can sort of program in the same sorts of allure that they do in VLTs. But the limits there in New Brunswick are up to $500, I believe it is, for a hand of blackjack. So the amount of money we're talking about here is very different from going into, again, your local bar or Legion and spending some money, although, as Michelle said earlier, it's very easy to blow a whole paycheck in a day if you want to do that. I'm wondering whether, hypothetically, if you were to sit down with a member of government would you make any recommendations regarding what those upper limits should be? Because they have not been set. As I understand here on Prince Edward Island, the online casino does not have those parameters in place now. Do you have an idea of what you would suggest an upper limit would be for those types of games?
What I would suggest is, and I know that those numbers are certainly a lot lower than some of the unregulated sites would be in terms of maximum bet, but what we're talking about here is affordability. And so I think that in considering that question, and again, we can't presume that just because the maximum bet is $500 that I'm going to go in and bet $500 right off the top. We need to understand, again, on a local level, what is the average bet for people here in PEI? And do we have that statistic? I don't have it, but perhaps that's a question to ask. What is the average bet that people are making? If it's 20 cents, yet the limit is $500, then hey, is that now as presumably as dangerous or as problematic as it once was? And the other point is to follow that trajectory over time. So to create a baseline of data and analytics and then follow it over time so that you can see whether or not, hey, that average bet is going up year to year or whether or not it's maintaining its stability. I think there's a lot of questions to ask in this realm over and above just looking at the kind of the maximum bet amount. I think there's a lot of questions there, which with regards to affordability and that sort of thing. And the other thing you have to consider with this, and prohibition. Nobody wants to tell. Certainly, we don't. I think most people would agree we don't want government telling us what to do, whether it's for gambling or for any other realm of life. So when we start to set limits on things, certainly they can be protective factors for some people and maybe harm-inducing for others. So for example, if I'm the type of person that has, I want to bet what I want to bet, that might actually turn me to playing in a much more kind of unregulated and unsafe environment in terms of the online gaming world. Other countries are not as nice as some of the more regulated play environments. And so when I'm thinking about health and protecting health, I want to make sure that people have the best information available to them when they need it. And I want to make sure that they have access to our helpline numbers and they have, care available, and not just care, but the best care that we can offer. So I think that there's a lot of questions to still be asked around that. And I just wanted to kind of, again, put that out there as a something else to consider.
Peter?
Thanks, Chair. And I am no expert in this field at all, but it does strike me that it just makes common sense that the higher the limit, the greater the potential for somebody to lose a large amount of money quickly, particularly if you're at home without any of the social controls, I think as Dr. Hodgson put it, with a credit card. So I'm wondering, I've heard from you, Nora, what your thoughts are. I'm wondering if Lisa has any thoughts or if there's anybody in the department who would be considered, a specialist to talk to that.
So Nora is the specialist in that. But, I hear what you're saying is that, probably there's other factors that we need to consider. It's not just about the number per se. However, I agree that we always need to make sure that we've got some harm reduction plans in place, some mitigation to support those people who are maybe not able to make those decisions in that moment. So I think there's more factors we need to consider, but I agree that it does need to be looked at, and we certainly have to have some ways to keep it as safe as possible.
Peter?
Question, Chair?
Yeah.
We know that you weren't consulted prior to the announcement that was made 3 days before Christmas. I'm wondering whether anybody has reached out to you since then to ask for your opinions on such things as the limits I've just been describing or the whole concept of this online casino.
Not at this time for me. Now, I know that conversations are evolving, so perhaps that will come as part of those decisions, but not at this time.
Yeah, nobody has reached out to me specifically, but I understand that it's kind of happening in the background. Yeah.
Right. And just to let the community know, we'll try to wrap up within 15 minutes. So is that okay? Is our guest okay?
That's fine. Yeah.
Great. Brad?
Thank you, Chair. And I really wanted to thank our presenters for coming in. Presenting before a standing committee is often tough. And, you've done a great job of I think, giving the information to the best of your ability, despite what are many times unfair questions. I think they attempt to put words in your mouth and that sort of thing. So I really appreciate that, and that's not always the case at standing committee. So thank you. And so I wanted to say that. Internet services, of course, are here to stay. It's a critical part of our life right now. And in fact, they help to address loneliness, for example, when you have the chat services and that sort of thing. Of course, you mentioned all the health services even being offered online, and then the pivot that Health PEI has made. I know my children, for example, an 11-year-old, 14-year-old, they do a lot of online gaming themselves, right? And we have to deal with in-app purchases. You're not talking about gambling per se, but those in-app purchases, the same sort of thing. And I mean, we have choices, right, where we can say, we're turning off the internet, you're not allowed to play, or you are 11 years old, you don't have a credit card, so if you want to make an in-app purchase, you have to come to us and we'll approve it. And so there's different ways to do that. And as well, I know in the education system, like there's digital citizenship courses and all that to teach children that sort of thing. And I know I kind of prescribe to the prepare the child for the path, not the path for the child type of philosophy. But when it comes to online, gaming and gambling and this sort of thing, what sort of counseling do you give your clients that may help them? Because it seems to me if you just cut up all your credit cards, it'd be very, very hard to go do online gambling. In fact, a follow-up question might even be, is regulated online gambling actually safer than land-based gambling? Because it's not like you can go in there with $20 cash and put it down on the table. So I'm kind of interested in that sort of thing, the strategies that you use when you're counseling your clients for online, regulated in particular, but all online gambling, and then how online gambling compares to land-based gaming.
So cognitive behavioral therapy is sort of the evidence-based treatment that we would give to people in general who might be struggling with gambling, and it sort of changes their thoughts and their feelings and behaviors. But it sounds like what you're asking is more about that harm reduction piece. And so sometimes there's things that we can do with clients, such as they might get a prepaid credit card that only has a small limit. We might advise them if they're wanting to stop using credit cards for other things, then they might buy cards for Sobeys or other things, so they're using gift cards rather than having credit cards on them all the time. So there's all kinds of little things that we can do to kind of help support them, setting timers, talking to someone so that they're accountable to say, I'm going to go on for the next half hour, please come get me. There's things that people can do to try to be safer, and so that's some of the work that we do, is that harm reduction. And then if they've decided that this is a problem and I need to completely stop that, then the treatment looks different.
Brad?
And I was wondering if you can comment on regulated online gaming, and whether it might even be safer than land-based gaming, especially in terms of the ability to monitor, and how anonymity kind of fits into that, especially for the regulated side, because my understanding would be you would have to provide your name and other information before you would even be able to gamble in an online environment.
I can certainly speak to that in terms of my knowledge around, and this might be, again, another question for ALC, in terms of them being able to provide fine details. But, I mean, there's obviously a ton of responsible gambling features that are present online that are not necessarily present in other ways, and certainly things like monitoring how much time is spent playing, or what the balance of your account might be, or even something like limit setting, as we were speaking of previously. Those are all things that are factors in terms of ALC.ca. I think one of the big considerations for people who do enter online or even walk into a land-based casino is privacy. People don't necessarily want to be tracked in terms of what they're doing, either online or otherwise. And certainly, one of the big things in terms, and for us, is protection of health again. So making sure that people under the age of 19 are not accessing this type of entertainment is a very important factor. And I know that ALC does have checks and balances in place around certainly certainly how someone would access having to have a credit card and all of those types of things. And it's done at registration, so that it doesn't have to be done later on. In terms of online gambling around the world, so offshore gambling, a lot of these unregulated sites are kind of tricky ones because there's no guarantee of a payout, number one, if you do win something, but also around the whole notion of a lot of these places I've heard have actually ask a lot of personal information type questions before you can actually access money that you've won or even money that you have in your account. And so, I've heard of people kind of putting money in, wanting to play, getting struck with these questions, and then saying, no, I think my privacy is a little more important than the maybe $50 that I have there that I was going to have some fun with. So these are all considerations in terms of that. And if you look at, I think the other thing we need to do is make sure that we're looking at all of the services and all of the programs that are available to a person. At the end of the day, nothing works if you don't. So in other words, the personal responsibility of someone, and I'm not saying, people need to hit rock bottoms. I don't believe in that either. I believe that, if you have an addiction or you have a problem, you reach out at any point in time. And part of mental health and addictions literacy is to teach people how to recognize the problematic signs and where to go if they need help. And I think in PEI, we have just a range. It's kind of a continuum. If you look at what's available at the casino, and if you look at what's available through Health PEI and what's available through the department, you can almost see a whole range across the ages and stages of services and provisions and programs to help people when they need it. So I'm personally very proud of that, and I'm also very proud of the fact that we collaborate and we integrate mental health and addiction services here, so that moving forward we're kind of well paced to take on any challenges that may arise. There's always going to be issues, I like the saying that no one's ever happy in healthcare. There's always going to be things that we're going to come across. But I think, even having this conversation today is a step in the right direction to be able to kind of share this knowledge, inform other people. Hopefully you walk away today with something new that you didn't know before that you can then share with someone else, all in the interest of the health of Islanders. So I guess that's
Great.
what I would say to that.
Great answer. So we have two more just quick questions if we can. Yeah. So we'll go with Lynn, and then Trish will finish it up, and I'll have a quiet. Yeah. Go ahead, Lynn.
Thank you, Chair. So this has been an interesting discussion this afternoon. I have definitely been contacted by a lot of my constituents who were concerned when this decision was made. They were concerned that there was no consultation with Islanders, that people didn't have an opportunity to weigh in on it. And they were also concerned about the impacts this was going to have on people that they love. So a couple of points that have been brought up from my constituents that I would like to put out here is that when government puts this forward, it can legitimize this for people. So there are people now who have gambling addictions who are concerned about entering their credit card information into these illegal sites. And it is a barrier that is preventing them from gambling further than they do currently. When government puts their stamp on it, there is the risk that people who weren't engaging in this activity are now, and government is profiting off of that. So that's one concern that I've heard a lot raised by my constituents. This legitimizes it for people. Another concern that has been brought forward to me is for families that are in recovery. They are trying to get their lives back on track, and that this opens up the door for them to get back into this addiction. It's a huge problem. We were talking earlier about what is the average bet. Let's be more concerned about the average bet. If the average bet is 20 cents, it really doesn't matter what the limit is. But to me, that's sort of a backward way of looking at it, because when we are talking about, for example, alcohol addiction, we're not talking about, well, what is the average Islander drinking? We're saying, how is this product being used by people who have a problem with it, and how can we help with harm reduction? So I feel like that would be a really backwards way of looking at it. If the average bet is 20 cents, but the person who is using it in an unhealthy way is indeed betting $500, then it's the $500 we need to be talking about, not the 20 cents. This feels really backwards. I also hear we are comparing the regulated and the unregulated. We're saying the regulated ones are going to be much safer, as if by the creation of them, we've gotten rid of the unregulated sites. They're both still there. That's just a false analogy entirely. That's not the case. Those unregulated sites continue to exist. If someone wishes to access these sites, all of the unregulated sites are still there. So I'm not sure how you believe this solves that problem, Minister. I don't see it.
Question
But-
for the guest?
No,
Yeah.
I'm making a comment actually, Chair, which you're allowed to do in committee.
Yeah, well,
So
we're
my-
running out of time and.
My
yeah.
comment is that there are a significant amount of problems that continue to exist. I fail to see, if we are not talking about caps, if this does not prevent unregulated casinos and online sites from continuing to operate, how does this make it safer? One question that you asked earlier is, how do we do better on this for Islanders? And my question to our guests is, when we are talking about people who are struggling with addictions, do we believe that government introducing these sites makes it better for those people? Do we think it does?
Question to our guest, yes.
I can only speak to the side of that I represent, that however it moves forward, that, you know, it's important that we're prepared and ready to support people.
Yeah, and I agree. One of the things I did want to clarify that you just mentioned is in terms of the average bet. I simply raise that as a consideration in terms of, you know, where are we? I do think we need to be more specific about what we're talking about in terms of, you know, understanding exactly what the situation of Islanders is. If we're talking about affordability and we're talking about whether or not this is safe, you know, would we be having the same conversation, I guess, if we knew that nobody was betting above $2? I guess that's the, you know, certainly I can go out and I can do a lot of things. That doesn't mean that I should or that I will do them. And I think there's a lot of presumptions around certain forms of addiction that maybe are not necessarily present for other forms of addiction. And gambling is a really interesting one, right? Essentially with gambling, it's not like alcohol addiction. With alcohol addiction, there's kind of biological checks and balances in place in terms you can only drink so much, and your body is going to shut you down. But gambling is quite different, so it comes back to being able to empower and support people to make good choices for themselves. Because at the end of the day, it's about locus of control. Who do you believe is responsible for your health? And the other factor in terms of mental health and addictions is the social determinants of health, which we haven't mentioned, but it's a huge factor. If people are always struggling to get by, they're obviously at a higher risk. Which means that those are higher risk factors for any addiction, not just gambling. And certainly if we don't fix or work on those issues, which I know you were talking to Michelle in terms of the causes of the causes, then certainly we'll always be sitting here having these conversations. The other piece that I might add is, if we believe, and there's research out there to suggest that literacy is the determinant of all determinants, then education and providing the right information to empower people to make good choices is more important now than it ever has been in history, especially with these COVID-related concerns kind of coming on top of the other mental health and addictions issues that we deal with on a day-to-day basis.
Thank you. Okay, perfect. Trish?
Thank you, Chair. And my question is very quick. So Nora, you've mentioned different research, throughout your presentation based on research. Research says we know that you haven't seen the two independent reports that were commissioned by the ALC, so it's not based on that research, which is apparently the research that was used to inform the decision by Cabinet. Just very quick, can you table or bring to the committee, send it to us, all of the research that you've referenced? I just get nervous when I hear based on research, because all research is not equal. So I just don't know what where that's coming
You know
from.
what? We have ongoing research. We actually have a research person who's also a policy analyst, and she's been researching gambling and gambling-related harms and online gambling and all of these aspects over the last number of years. So I don't know if it's feasible to necessarily send you everything. It's kind of a wealth of knowledge, and it spans all the way back to the earliest research by some of it, and includes Dr. Hodgins' research as well. So it's everything and everything in between. But again, I go back to, you get to a certain point in research where you're starting to hear the same types of themes emerge. And once you get to that point, it's a kind of a point of saturation. Then it's important to go to the local level and ask those questions. What is happening here on the ground, and how do we respond to it, as opposed to kind of the global research that exists, if that makes sense.
Yeah. Thank you, Chair. No, it's definitely possible to produce the research that we're making decisions based on and that we're making statements based on. So there's a researcher who's been working for 3 years. Wonderful. Let's see what has that researcher directly produced. Of course, that would not be all that you're informing your decisions on, I'm sure, because that's not independent research. Basically, when we're making statements, they need to be supported. So I would like you to give it a try and send us as much as you can so that we can have that information.
I guess, gambling is a huge...
What are you basing your statements on? You've made so many statements today.
Just generally what the research kind of says globally, and that's what I'm basing my research on, and also my own past lived experience in terms of working in this area.
Sorry, just
Trish?
very quickly. I appreciate the distinction between lived experience and research that you are referencing is a very important one as well. So I'm not sure we've made that distinction throughout. But
just accumulation of knowledge, I guess, is kind of coming from all sorts of different areas, whether or not whether you're speaking with a gambler, or you're talking with a family, or you know a family member who may have struggled, or you know someone who's in recovery who is being very, very successful within the system, or it's just the accumulation of all of that. There's the evidence-based research, and I also consider those things to be evidence, certainly.
Great.
evidence-based research, let's send it our way. That's it.
Perfect.
Thank you.
I just had a couple questions. The review of gambling and addiction services in the budget book from last year, I think it was $5,100. What was that? What came out of that? $5,100 was allocated to review of gambling addiction services in the health policy. Can you?
I would have to check into that. I don't work on the budget.
Oh yeah, but it was in health policy and program. So I just wanted.
Okay.
To,
yeah. No, I can definitely check.
If that report is there,
Yeah.
can you?
And can you say that again? It was the review.
Yeah,
of?
it was the review of gambling addiction services.
Okay.
And it was a $5,100 budget line in the budget under health policy and programs.
Okay.
And then also the gambling addiction support line. Can you tell me a little bit about that?
Yeah, sure.
Yeah.
We're actually we have a yearly media campaign on that. The Gambling Addiction Support Line is meant to really provide 24/7 access to the range of services that we have available here. And most provinces and territories have a similar line that's used in the same way. And certainly anyone can call that line. There's no time limits on the line or anything like that. You can call to either make a referral for services for yourself, or you can call as a concerned family member or a friend. And it's a free service, and it's been, I think, available now for a number of years, at least since 2000, I want to say maybe 8 to 10, somewhere around there. Yeah, I mean, it's a great service if and when someone needs it. Certainly, we do a lot of our media campaign has turned to kind of online sources. We know from internal analytics that that's where people are, and certainly we're focused on that. But you might see you might hear an ad on the radio. You may see it in the buzz. You may see, actually, you'll also see posters up in each of the physicians' offices around Prince Edward Island, as we just 2 years ago sent out materials for frontline physicians to be able to promote that line as well and use of that line. So, yeah.
The reason why I'm asking is those are all good, but in the budget, there's only $1,000 and $1,050 allocated to that line, and it says call center, and then it says gambling addiction support line, $1,050. So there's something astray about.
I'm not sure. I haven't seen that.
Yeah.
Again, I don't work with the budget. I certainly, but any spending that we do has to be approved by managers, and so I don't work directly with that. I would have to look into why that is.
I'd like to get some more information back, maybe to the committee on that, because it doesn't seem like that is a very high number. And I want to know too if that's outsourced outside of Prince Edward Island.
Right. One of the things I can tell you about the line is certainly that it is leveraged outside of PEI through a company in New Brunswick, but it is leveraged through and in partnership with the government of New Brunswick, and has been for some time. The other thing is that it typically has low call volume, and I think there's two reasons for that. One is the shame and stigma associated with reaching out around gambling-related harms and problems. And the other part is that perhaps people don't know it exists or don't turn to it, specifically if they have comorbidities. It's I'm thinking of someone who may be under the influence of alcohol, perhaps, and perhaps they go through other avenues. We know that, online is an option. We know that calling the Provincial Addiction Treatment Center is another option. People do that directly. We also know that people access services through the gaming floor and the PlayWise team at alc.ca or ALC, and they can also access services through alc.ca. So there's a number of ways to kind of, and I think the notion of, there's no wrong door here is an important one in terms of giving people choices about how they reach out and who they reach out to and when they reach out. So.
Okay. Well, we'll be chatting more about this in this committee for sure, and it's a great topic, and you did very well as presenters. So Lisa and Nora, thank you very much for your time today. And what we'll do is we'll take a short 1-minute break. We'll just give you a chance to leave, and then we'll wrap up the meeting as quickly as we can. Thank you very much. We're back. We're going to move on to discussion of scheduling with the committee. So February 10th is looking like a pretty extensive day for the committee. In the morning, we'll have a presentation on cystic fibrosis and type 1 diabetes. In the afternoon, presentation from Dr. Morrison and Aaron Bentley. Just to note, the Minister of Health will not be joining us for that meeting. Before, it was going to be the minister at the time, but the new minister is not going to be joining us there. The mobile crisis unit, that was a presentation that we were going to have last week, and it got pushed on to the end of that day too. So that'll be a pretty extensive afternoon there. As just wanted to let you know about that. Would the clerk add anything to that?
No, as long as that's okay with the committee. I haven't sent out the notice for that meeting yet. The mobile crisis unit rescheduling. I was waiting to hear if the new Minister of Health would be attending, and I had heard back during this meeting actually that he wouldn't be. So I'll send that out as soon as possible, but just let the committee know that it will be possibly a longer meeting, or I guess the committee could decide to limit the time similar to today, is a strict hour for each, or it's up to the committee.
Hannah?
Chair, can I ask if we've had any response from the Minister of Finance with the request to be attending a committee as well?
Yep, they are open to attending on the 18th. I was just waiting, because I had a hold on that day for Minister Thompson, since he had kind of a deadline to appear. I was looking at possible dates there too, so.
And that would bring us to the next point too. This is a committee decision, obviously. Minister Thompson was invited, and we're at a scheduling issue right now where we had a time frame. I think it was a 2-week time frame. So would the committee be open on a rare occasion to having us use a Monday for that meeting to meet that deadline? Either Monday, February 8th, the 15th, or the 17th? No, wait, that's not a Monday. Yeah.
So we just, with the calendar being so full, had limited dates to provide. Yeah, you want to jump in?
I was going to say that week is meant to be our planning week, but because the date of the opening day has been moved to the Thursday instead of the Tuesday, then the Monday and Tuesday are effectively free. Like if you look at the way the calendar's been done, normally it would not. We wouldn't be looking at committees in that space, but I wouldn't want to speak for anybody else on their availability, and in case they'd use that time for other plans.
And I think it was just brought up that that's Islander Day, so I don't know if the committee has an issue. The 15th.
22nd is Islander Day. No, 15th. Is it the 15th?
Yeah, February 15th is Islander Day.
Oh, okay. I thought it was the 22nd. Okay, good. Got it in the wrong place in my calendar.
Yeah.
So I guess for additional dates to provide them, either the 8th or the 17th would be, if the committee's okay with me kind of offering those two dates up.
The 17th, we were in planning at that point. We're not, so I don't think our caucus will be available.
I don't think that's accurate because the Thursday is the 25th is the first day of the sitting, so it would be from Thursday to Thursday, right? Not the Wednesday.
Okay, I'll have to get my calendar updated. Yeah.
And we do have already have another meeting scheduled for the 17th, correct? Of the standing committee. I thought we did. No, we don't? Okay. I thought we had discussed that last time, using that time on the 17th. Alicia, is that?
Yeah, sorry. So I guess it's also up to the committee how they want to prioritize that, because and I apologize, I think I said the 18th for Minister Compton, but she's willing to come in on the 17th. And I know the Information and Privacy Commissioner is also flexible and could appear that day. But if the committee had prioritized Minister Thompson, I guess I just want to know where the committee sits with prioritization, because I think a few people are available on that day. But I don't want to book it and then have Minister Thompson say he could appear that day, if that's the priority of the committee.
Trish?
And we've also had, instances where we've had a morning and then an afternoon, so I don't know if that's possible. We can talk about everybody's schedules. I would certainly be open to that to make sure we cover as many things as possible.
Yep, so I do currently have a hold on that morning. However, I do know there are other committees currently looking at that morning as well. So it's kind of at this point a first come, first serve. So I do have the morning as an option to the minister preliminarily before I discuss this with the committee, but I hadn't heard back yet, so.
Anybody else want to?
Secretary, can you just confirm what days we're looking at now?
17th, we're looking at the 17th. 8th won't work because it's this Monday, right?
Yeah, well, Mondays are constituency days too.
That's why we're looking at the 17th maybe to run a series of meetings, maybe morning and afternoon. We're just trying to look at seeing what would it be priority to have Minister Thompson in at that time? APSO, is it APSO? Yeah. Mm-hmm. Yeah.
And we also have the afternoon of the 12th currently out to the minister, but I believe that is, again, outside of the time frame. So I guess as long as it's okay with the committee that some of the dates being offered are technically outside the 2-week deadline that we gave the minister, just for flexibility's sake, because the calendar was already set quite full. I just want to make sure that's okay with the committee because it was in the motion to have 2 weeks.
Great. Yeah, so we'll look because it was in the motion. So, okay. So is everybody okay with that? Can we, Brad? Do you want to?
I think I got it.
Okay. Yeah. Just keep Wednesdays and Fridays open.
Well, it's hard.
Forever.
It's hard for me to dedicate an entire day for standing committee meetings.
Yeah.
With my other responsibilities. And typically with the committee, we've said we're gonna have it standard days, right? Wednesday afternoons or Friday afternoons, so.
Yeah.
It gets difficult because I have meetings scheduled in, and there'll be a lot of those meetings I can't make.
Sure.
Not to get subs, just
Sure.
FYI.
Yeah. I would just ask the committee to respectfully try to get a sub in for that day if you can't make it, for sure. Yeah, great. Trish?
And just a quick question. So the presentation we were scheduled to have on the mobile mental health units, that had to be canceled at the last minute. Realizing, of course, that our schedule is full, but is there any space to reschedule that? It was something we prioritized as a committee and would really like to get that information if we could.
So they are willing to come in on the afternoon of the 10th, but that just makes the day quite long. So it was up to the committee on, I guess, if we want to have them in, make the day longer or limit their time of the committee or of the meetings to allow for them both to appear. I know the first presentation was originally moved to another day because it was a larger topic. With the supervised consumption sites, they wanted to give that a good period of time to speak about. So I didn't know if the committee wanted to approve that date to have mobile crisis as well.
10th, everybody? So everybody okay with?
On a short time frame, does it not seem that the priorities are getting kind of like, I'm having trouble trying to keep track of everything, you know what I mean? Like, is it getting too diluted? I don't know. I'm just putting it out there.
A lot of topics under this committee, so.
It is. I don't,
Yeah.
and again, I'm new.
Yeah.
I'm the new person, but.
Yeah. No, these were all priorities that we were trying to get through, and there was a few brought on, like motions come up like that, so we're trying to accommodate and make sure that Islanders hear from this committee. I think that's priority, so we'll put them on the 10th, I think is the best thing to do for that, Trish, and it'll be a long day, but we'll get through it shortly. We'll try to keep things down.
Can we put time limits on them or no?
I'll put time limits if I feel fit to do that. So, yeah. But, yeah.
Might not have quorum.
What's that?
Might end up without quorum if they're too long, but anyway, we'll see.
That shows where priorities
So
are.
yeah. So I mean, is it that you don't want to talk about that topic, or is it like what?
No, just looking for reasonable timeframes and reasonable meeting dates, that's all. I mean, as part of the standing committee, I'd like to be able to attend the meetings, but I mean, I know there's lots of topics, lots to talk about, but I think we have to respect the other responsibilities and the plans that we made and the times that we set aside as a committee too. Just throwing that out there, Chair.
Yeah, sure. And again, there was 2 motions brought up. The committee was full before that. There was 2 motions brought up from a member of the committee, which was very important. We're trying to put those in place, and we're trying to get to the session of the ledge. So we do have a lot of work to do, and I'm just asking gracefully that the committee buckle down and get ready to go for the next 2 weeks. Important stuff. Thank you. At this time, any new business? Oh, God. Okay. Can I get a motion to adjourn? Zach Bell.